put this, this is to explain how to put the foams on.
Yes.
And so step by step, you've closed already the first 3 hooks, so we have kind of a belt that is very stable here at the waist, and that is essential. Step number 2 would be to have the sleeves with the strap closed on both sides. Is it closed on the other side? Fantastic. The way I recommend to use the foams is to have 3 foams, and one goes to the front, and the easiest way to apply it is to have these first 3 hooks closed and then sit it on the groin underneath and underneath the bra. 1 and 2. Okay. So this garment is, you can see that it's new.
Tight, huh?
Okay, but it's okay. So this is foam number 1. Nice and solid between the belt and the bra. The number 2, the same. So it is only 2 weeks following the basal liposuction and fat injection to hips and buttock. And so again, we don't want compression on the fat injection side. Let's say we want compression higher up. So that's where the foam goes. She already has the bra on, so you can secure it underneath the bra. And then the sleeve goes up. Okay. Voila, easy. And the same maneuver on the opposite side. Ideally, you fix the foam where you want it to be, and then you fold it in. And I like to have a corner that reaches the triangle just behind the scapula, because that's an area where I also do liposuction. I try to be very thorough there. And then the sleeve goes in. Now from here, the hooks can be closed. No, they don't need to be closed in a way that is too uncomfortable. So in this case, we are on the first because it is a new garment, but we need compression to help the skin to heal in a smooth way, but not extra compression. If the garment doesn't make you breathe, that's not a good thing. Okay, once you reach this level here, you don't need to close. If you look at the mirror, you don't need to close the last 2 hooks. You don't need something that gives you compression under the breast. And even if there are wrinkles, you can correct them. But because you have the foam, now we're sure that everything will be nice and smooth. Okay, the very last thing is that sometimes, in particular with the augmentations that are more prominent, now she has a very narrow waist and full hips, then there might be too much compression on the fat injection area. And for this reason, I like to cut the garment. And I usually cut it on the midline for 3 to 5 inches. Just along the suture. Okay. Do you feel the difference?
Yes, a bit better now.
Is it a bit better?
Yeah.
Okay, you can also go higher up. Okay. 1 and 2. Okay. And so this, in particular in this area, I don't want you to feel anything too tight or uncomfortable. So we have applied the binder after we have 1 layer of foam and 1 layer of garment. Now the binder sometimes, well, it's essential because it helps very much in keeping the posture right, which will pay the dividends, although it might be challenging at the beginning, because if your core is straight, then the skin heals much smoother. But sometimes, because the material is more rigid, then it can either cut into the breast or into the hips, because now we have a very pronounced curve on both sides. So the solution in these cases is to do some cuts into the binder for up to 2-3 inches on both sides. And how long we go? Well, we don't want any compression on the fat injection side. Well, we can do the same on the side of the breast. And so you're still left by the end of this, you're still left with a nice belt of compression that is exactly what we want. That is from the last rib to the beginning of the iliac crest. So this is does it feel more comfortable now? Yes. Okay, excellent. And now you're not expecting this to wrinkle anymore.
Yeah.
If you whenever it wrinkles, like for example, you have something here on the back, you can again cut. And it doesn't wrinkle anymore. Okay. Boom. Perfecto. All right, better?
Yeah.
Looks better.
All right.